is a joint project between Outbreak International and the International Policy Center for Inclusive Growth. My name is Daniel Horn. I'm Economic Advisor for Social Protection, Outbreak International, based in London. And together with the International Policy Center, we have brought together in our previous webinars and the current one, experts and stakeholders from a range of backgrounds to discuss their work on thoughts on the growing concern among humanity towards not just the distribution of social protection in terms of services and benefits, but also finding the resources to ensure that the commitments to social protection for all, in the spirit of leaving no one behind, is backed by reliable and pragmatic financing capacities. I'd like to introduce our panelists today, Dr. Jeremy Seekings from Cape Town University, who is the Interim Director for the Institute of Democracy, Citizenship and Public Policy in Africa. Jeremy is also a professor of political studies and sociology and a visiting professor at Yale. His books include Class, Race, and Inequality in South Africa, Growing Up in the New South Africa, Childhood and Adolescence in Post-Apartheid Cape Town, and Poverty and Policy and Politics in South Africa. He runs the research program on the politics of welfare reforms in contemporary Africa, and is also researching the history of welfare state building in Africa and the Caribbean since the 1930s. Our second panelist, Ms. Aura Sevilla, from COSE in the Philippines, the Coalition for the Services for the Elderly, is a project coordinator and a civil society organization working for and for the goal of providing sustainable and adequate benefits for older persons in the Philippines. And she works on addressing the country's means-tested social pension program, gathering evidence, and advocating for change with the government. She also networks and capacity builds for older people to effect institutional change. Now, a few housekeeping rules before we go forward. We welcome questions from the audience. There will be 2 rounds of questions. The first round we will be selecting participants to ask their questions directly to the panelists. So if you could send us your messages, your questions in the message box in the app, we can find those and ask you personally whether or not you'd be willing to ask those questions online. The second round of questions will be, given how much time we have left, will be asked by myself to the panelists. And again, if you could address each panelist you would like to answer your question, we can make sure those get to you. Don't be afraid if you have questions, no matter how big or how small. We will be putting those online and addressing, the panelists will be addressing those, so you will get answers to those questions. I would like to turn the discussion now over to Jeremy and his presentation. Jeremy, can you join us?
Hello, Daniel. Hello, everybody else. Can you hear me?
Yes, I can hear you fine, Jeremy. I think everyone else can as well.
Okay, excellent. Shall I turn on my camera as well, or are we going to not risk that?
We can try with the camera, Jeremy, if you prefer. Yes, yes, please.
Yep. Let's try that. Hello. So if everybody can hear me, you'll have to stop me if you can't hear me. I want to spend the next 20 minutes thinking about the nature of, the politics of affordability. We know that there's a lot of discussion of affordability in the social protection debates. I want to interrogate what it means. Can we have the next slide, please? I want to explore what I'm calling the affordability gap. And the affordability gap is the gap between what international agencies and experts and often advocates in civil society, what they recommend on the one hand, and what national governments agree to on the other. So this gap is a pretty large gap. All over Africa, which is the part of the world where I do my work, international agencies of all sorts recommend individual cash transfer programs that cost 1% or more of GDP and in total cost several percent of GDP. governments in Africa have been very reluctant to introduce reforms that cost anywhere near that much. In fact, if we look at individual reforms in a variety of African countries, it's very rare for national governments to approve of a reform that costs much more, or costs more than 0.4 or 0.5% of GDP each. So in other words, there seems to be an affordability gap between what the international agencies on one hand say and what national governments in Africa are prepared to accept. What I want to do this afternoon here in Cape Town, is to examine very, very quickly 3 cases of reform in Africa, in Zambia, Botswana, and Zanzibar. If we can move on to the next slide, please. I want to suggest that affordability is not just a fiscal issue. It's really also a profoundly political issue, of course, and a normative issue, and we need to recognize these dimensions. So I'm going to be talking about research that we've been doing in a set of African countries. Next slide, please. The 3 cases I'll be talking about are Botswana and Zambia in southern Africa, and the island of Zanzibar off the East African coast. Zanzibar is part of Tanzania. It's a semi-autonomous territory within the United Republic of Tanzania. So these are 3 different territories in East and Southern Africa. And well, we have some pictures here. On the top left, you have the Victoria Falls in Zambia. Top right, we have Old Town in Zanzibar. And you can see Zanzibar is an island, there's lots of sea. And on the bottom left, we have Botswana, and this is a picture of a town called Machudi. And Machudi is, like many towns in Botswana, in the middle of a very dry, arid environment. So we've got 3 quite different environments in important respects. Next slide, please. Now, I want to start off by just thinking about what international agencies tell us. So for the last really 11 years, 12 years, international agencies have been doing a lot of work on affordability. And the work really involves looking at costs on the one hand and revenues on the other. Costs is where most of the work has been. That beginning really in about 2005, the World Bank, the ILO, UNICEF did major costing studies of different countries. Since then, there have been many individual country case studies, and typically these costing studies cost programs, and of course, depending on the design of the program, the costs will go up and down. A universal program will generally cost more than a targeted program. Program with severe age restrictions, for example, a high retirement age for pensions will cost less than one with lower retirement age or more easygoing age restrictions, and benefits can be higher or lower. So depending on how one varies those characteristics of a program, of course the cost of the program and the cost of a set of programs will vary enormously. That also, more recently, international agencies have done a lot of work on fiscal space, meaning the revenue side of the equation, what revenues are available, and what revenues can be raised, even in countries which don't have extensive tax revenues at the moment. And the conclusion which international agencies and experts almost always come to is that safety nets are affordable, that social protection programs are affordable for a variety of constituencies. And the World Bank buys into that assessment. ILO more strongly, UNICEF obviously making it very strongly with respect to children. Agencies like Help Age International, NGO, of course, making that point with respect to the elderly with pensions. Next slide, please. If we take an example of this, the example that will be coming up in a moment is Zambia. And Zambia is a country where the ILO did costing studies in the 2000s, and in 2008 they did a study which costed different programs, costing more or less 2% of GDP in total. And then later, they did a study of fiscal space in 2011, which concluded that increased taxes, etc., would easily be able to generate the revenues, in this case 3 or 4% of GDP, which would make possible a full set of social protection programs. And in this analysis, it could almost all be domestically funded. Donor funding, foreign aid would only be necessary at the very beginning of the process. Next slide, please. The problem, of course, the first problem with these kinds of assessments is that they're often done independently of assessments of other claims on government budgets. Some of you may be familiar with a very interesting paper by Hager, Zanker, and McCall from 2010, where they looked at the various spending commitments that African governments had signed up to, and they costed them. So, for example, in 2008, African governments notionally signed up to a target of spending 4.5% of GDP on social protection. None of them actually do that, but they said they would work towards that. But they've also signed up for commitments with respect to health, education, water, sanitation, agriculture, and infrastructure. And what Hager, Zanker, and McCall did, which was an effective exercise, was to say, what all of these costs if you achieve them, what will they cost together? What will the total cost be? And the answer is it will exceed total government revenue in 4 or 5 cases they looked at. So the first concern about affordability, of course, is that the money spent on social protection is often money that isn't available to spend on other areas of government spending. And this is a fiscal concern. So this is an issue. It's not actually the issue that I want to focus on primarily. I really want to focus on how governments really think through the issue of affordability in practice. In our proposals, where there's a real possibility or an option of an extensive new program. So if we have the next slide, please. I want to look at Zambia, and the next slide comes up. Will that next slide shows capita in these countries, and see that we're looking at 3 very that in Botswana was below 50 independence.
Jeremy, sorry to interrupt you. We're just having a hard time with the bandwidth. Perhaps it might be better without your video so that we can hear your voice. Sorry to interrupt you.
Okay. How much have you not heard?
Maybe about 1 minute, not too much. Good.
Okay. My video is now off. So just, Daniel, you can't hear me, just say so.
Yes, Chairman, we can hear you. We can hear you slightly. I think it's better.
Okay. So this slide shows that Botswana has gone from being a low-income country to a high-income country, and introduced full-age pensions more or less in the middle of this progress, in this period of growth, which has been very reluctant to reform, remains a low-income country. In fact, it's poorer today than it was independence. Zanzibar introduced last year in 20s. I'm worried you lost me totally now. Daniel? Daniel?
Yes, we can still hear you, Jeremy, but it is a bit patchy on the connection. So you might want to go slightly slower so that we can catch the words. I think the audience might agree.
Okay. So Botswana, the first case we're looking at, it was the first country in Africa to introduce pensions after South Africa, Namibia, and Mauritius. It did so in 1996 after a period of debate. Pensions are universal, but the benefit was set at a very low level compared to South Africa. The important point to emphasize here is the initial cost of this program was about 0.5% of GDP. The Botswana government could have designed the program so that it would cost much, much more along the lines of the pension program in neighboring South Africa, which costs more than 1% of GDP. I'm going to say a little bit in a moment about how it came about and how it grew out of other programs. Zanzibar, which introduced universal pension last year in 2016, began to pay it in 2016. Zanzibar had a very different process. In the case of Zanzibar, pensions were proposed initially by international agencies, the ILO, Help Age International. After a period of deliberation, the government chose in 2014 that pensions would be introduced, 2014-2015 would be introduced with quite modest benefits, quite a high age threshold. The total cost would be only 0.4% of GDP. So we see here are two cases of countries with very different political processes, which in both cases the national governments opt for programs costing about 0.5% of GDP, and they reject proposals for more expensive versions of the same program. Can we move on to the next slide, please? And then with the next 3 slides, move through them quite fast. So in the case of Botswana, the old age pensions grew out of a whole set of programs concerned with drought relief. And these were initially funded by outside agencies, especially the World Food Programme. And gradually the government of Botswana took more responsibility. Next slide, please. These were quite expensive programs, but they were initially really seen as emergency programs. In the mid-1990s, what happened is that the government of Botswana really took responsibility for these programs because external agencies were withdrawing. So it took responsibility for feeding schemes in schools. It also took responsibility for a section of the population who were always destitute, always in need, whether there was a drought or not, and that was the elderly. So pensions were introduced. Next slide, please. Subsequent to this, over the last 15 years, the government of Botswana has actually worried that maybe it overreached itself because it ran into a bit of a fiscal crisis in the end of the 1990s and early 2000s, and since then has only gone for very small, very inexpensive reforms and has rejected a series of more expensive proposals. So here's a case of a country which went for a middle expenditure option, if you like, a program costing 0.5% of GDP, but was really worried, especially afterwards, that maybe this was a more expensive program than it could afford. Next slide, please. In the case of Zanzibar, we can see that Zanzibar is a much lower GDP per capita country, territory, and here, this is a country, a territory, a government which does not have anywhere near the same resources as in Botswana. Here, pensions were the first major program to be introduced. There wasn't a prehistory of welfare programs as there was in Botswana because of drought. This was the only one, and as I say, when they introduced it, again, they rejected expensive versions of the program. They went for what was the cheapest version of the program, which would only cost 0.4, 0.5% of GDP. Next slide, please. If we think about the politics of this, or what we might call the political dimension of affordability, or even political affordability, we can see that there are some similarities between the cases of Botswana in the 1990s and Zanzibar in the 2010s. In both cases, there was some pressure from civil society. There wasn't, in fact, very much pressure from outside in the case of Botswana, whereas there was a lot of pressure from outside in the case of Zanzibar. But in both cases, there was an important impetus to reform from the political system, from multi-party competition. These were both cases in which the governing parties really wanted to shore up their support base in the face of electoral challenges. And if this is really an absolutely crucial factor. In Botswana, in the mid-1990s, the diagnosis about fiscal conditions was very positive. The Botswana government thought it had a lot more money than it did. Subsequently, when there was a bit of a fiscal crisis, the Botswana government began to backtrack on expanding its welfare system. So, very different, in some ways similar conditions, in other ways different conditions. But in both cases, a reform coalition came together, but around a much cheaper version of the reform than had been advocated by strong advocates. Can we go on to the next slide, and then almost immediately the slide after, please, on Zambia. If we look at the case of Zambia, Zambia is a case of where, despite considerable lobbying from external agencies, from international agencies, the government has been very reluctant to introduce expensive reforms. And in the case of Botswana, in the case of Zambia, the programs that have been introduced are really very modest, costing only about 0.2% of GDP. The government has prioritized other spending, especially on infrastructure, over cash transfers. So this is a case of where the government was not even willing to go to the kind of spending level, 0.5% of GDP, that the governments in Botswana and Zanzibar did under other circumstances. And in Zambia, there's no old age pension yet. It's still in a very embryonic form. It's really still on the drawing board, and there isn't a strong momentum behind it. So next slide, please. And I think I'm actually going to make this my last slide, and I'll talk to it, and then I'll conclude. If we look at this process in general in African countries, what do we see? Well, we see a process which generally begins with international agencies costing reforms and advocating reforms that cost quite a lot. And then we have buy-in from some government officials, but we have considerable skepticism from other government officials. Now, this can lead to reforms. It generally leads to reforms when fiscal conditions are conducive, when government has or expects to have good revenues, when the politics within the state is conducive, and when there is pressure from electoral competition on government to introduce reforms. But there are important breaks. And the one very, very important break is that by and large, political elites in most parts of Africa are very, very suspicious of cash transfers. That whether they are seen as fiscally affordable or not, they are not seen generally as being the most pressing priority for national governments. There is strong skepticism, especially about giving cash transfers which might support people of working age who might be encouraged to become dependent. There is a really big concern about dependency. So, as a result, there is a gap between the expensive proposals advocated by international agencies and inexpensive outcomes which generally result at the end of the process. Even in those cases of where there are substantial reforms, as in Botswana or Zanzibar, the cost is generally kept down to a low level, far, far below what international agencies consider to be affordable. And in other cases, such as Zambia, the opposition is such that, in fact, they don't even get that far, that the spending commitments are even more modest at just 0.1, 0.2% of GDP. So then my conclusion from this, before we move on to hear about the Philippines, is that this gap that I'm talking about, the affordability gap, it's not just a technical or fiscal issue. It's also a normative and a political issue. And we have to really understand that. Of course, hence the importance of thinking what kinds of political processes help to build a reformist coalition. But in general, in the African cases, pensions tend to be easier to achieve than other forms of social protection program. Pensions seem to be slightly easier than others. Right? But in any of these programs, the lesson from African cases is that real reforms generally occur on an incremental basis. In other words, expensive reforms just don't happen. If you have a bold ambition, you have to figure out how you're going to package that as a series of appealing small steps rather than as a big step. So governments might be persuaded to spend intermediate amounts, 0.5% of GDP, but you're not going to persuade governments to spend 1% of GDP. So if you've got bold ambitions, start modestly and then try and expand them. Don't think that it's going to be easy to jump in the deep end. Thank you very much.
Thank you, Jeremy. Great presentation. I really appreciate you working with us through the technical difficulties. If we could just move on to Ms. Sevilla's presentation, and again, while we're setting that up, if you have any questions you'd like to ask the panelists directly, please just let us know, and we'll forward that to them so they can answer you online. And now I turn over to Ms. Sevilla. Aura, thank you very much for joining us.
Yes, thank you so much, Dr. Daniel. Good evening, everyone. Again, I'm Aura from Coalition of Services of the Elderly. So, what being discussed by Mr. Shikings has been very similar to the experience of the Philippines, but I won't deal much on the issues of affordability gap, but this is more of the actual experience that our organization have done in advocating for fiscal space for social pension. So this is particularly on how we have built the capacities of older persons in pushing for reforms for social pension. So next slide, please. Next slide, please. Yeah. So you can see my outline, background of the social pension, and gap successes and key lessons learned. Next slide, please. So basically, just to give you an overview, how the social pension started in the Philippines, the advocacy started in 2002. So we learned about social pension through HelpAge International. We attended a course at South Africa as well, learning about the models of social pension. So in 2005, we conducted a research to analyze the situation of older persons in the Philippines. So we asked them what is poverty, what's making them, what's the issues of income security in particular. So in 2007, we drafted a social pension bill, and then this was filed during the International Day of Older Persons. So the opportunity that it's the International Day of Older Person when we filed this one. And then this initially was rejected in the House of Representatives. So there's two chambers in the Philippines, like US, we have the lower house and we have the upper house. So in the lower house, it was rejected, but the version of the bill was still in the Senate version, so it came also part of the deliberation in 2010. So in 2010 it was passed, but it was passed in the Senate, and then in February 2010 it was signed by the President. Next slide, please. Okay, so our main partner for all this that has happened is Confederation of Older Persons Association of the Philippines. So next slide, please. COPAP, as we call them here, is a grassroots organization organized by COSE starting 1989. So we started to organize them, and they became a confederation in 2006. Most of the members of COPAP came from low-income groups because the government also has the other group, which is mainly coming from the retirees group. So they are the ones, what we call more of a top-down organized by the government. So next slide, please. Next slide, please. Just to show you a picture of how COPAP is. COPAP started at the village level. So they are organized based on issue-based. They are based on their issues, if they have common issues, and then they were being organized. Usually, in the barangay level, they have only 50 to 60 members. And then they become a federation at the city or municipal level because they have to deal with the city level. And then they became a confederation who is dealing with the issues at the regional and the national level. So at the moment, COPAP has 14 federations. So they have 6 zones, or a total of 129 OPAs, or older people associations. They have a member of 1,756 as of February 2015. So next slide, please. Okay, so what happened is that during the lobbying, the first request or the demand of the older people is to have a pension of 1,500. So, but during the deliberation, of course, the common questions like this cannot be afforded by the government. So, one of the senator approached the COPAP and said, to get your foot on the door, we have to start at 500 pesos, which is just $11. And then we will review the law every 2 years. So COPAP agreed that yes, we agree with 500, provided that this will be reviewed every 2 years. So one of the questions during the hearing, as well as the usual, that where to get the money. So one older person said during the hearing that they projected that they showed the experience of Bangladesh, who also have the same economic development as the Philippines, who has a pension for the poor, and how come Philippines do not have a pension for its poor older persons. So another argument that they use is that older persons have been contributing already to the pockets of the government, so it should be that the government should pay back all this, the hard work of older persons that they have contributed to the coffers of the government for more than 60 years. So, and then they also have this list of where the money should come from, which is also coming from our research. So next slide, please. However, February 14, the President don't want to sign the bill because primarily the Ministry of Finance opposed that there is no money for this. So they always said that there's no money, no fiscal space, we cannot do this. What COPAP did is they went to the palace, they went to the President, and then mobilized there as early as 5 in the morning, and then tell The, so the day after, February 15, so the law was signed. So next slide, please. So the law was signed in February 15 in 2010. So this was mainly because of the mobilization that happened. Next slide, please. That happened in the Malacanang Palace. So next slide, please. So social pension provides now 500 pesos per month to senior citizens identified as indigent. So next slide, please. Indigent is referred or identified as frail, sickly, with disability, without pension, permanent source of income, compensation, or financial assistance from his or her relatives to support her needs. So as you can see, the definition itself is also quite subjective. That's also making targeting so difficult. So next slide, please. So in 2011, next slide. The social pension was implemented, but with budget allocation limitation. So they passed it, but the problem is, again, even it's in the law, the Department of Finance and the Budget and Management said, no, we do not have money for this. But during that time, next image please. During that time, the target that time is 1 million. So, but the only covered by the money provided is only 7%, 77 years old and above. So, even they have already targeted, the money do not still is not enough, because the law says that they should give it to 60 years old and above. So, what we did is that, next slide. So what you can see here is really a gross violation of the rights of older persons, that even it's in the law, even if there's a provision, they still have not followed or implement the law as it's written. So in 2013, we started to do a budget engagement. So we have not done this in previous years. So this is the first time that we did it. So there's a group that's called Social Watch Philippines. So what Social Watch is doing is that they provide an alternative budget initiative. So we push that the money should be, that the people should be the one that the one who should decide what programs that they want. They should be the ones who should decide for which programs the government should prioritize to. So that's what Social Watch is doing. So, and also this is a network of other CSO who has been demanding for budget allocation to specific programs. So we started to join that group in 2013. And then we also increased the older person's policy influencing skills. So we trained the COPAP leaders on budget processes, when the budget happens, who prepares it, who the one to meet, who the one to call, where to get the data. And then we also train them how to write position paper, and also stakeholders mapping. So it's basically increasing more their skills on how to deal with government. And then lastly, we also participated in budget hearings. So even how late it is, even it's 10 p.m. or late, we joined the Congress hearing and the Senate hearings during the deliberations of the budget to make sure that the budget allocation for older persons are intact in that budget time. So what we also did is we met with several congressmen ahead, and also during the lobby, during coffee break, we keep on talking to congressmen. So, and then we just give them one-page position paper, so that before prior to the budget hearing, they will deliver our position. So that's mainly what we did. It's more of a lip service. So we keep on talking to our champions or to those we think, primarily also lawmakers who are quite older, who might sympathize as well with older persons. Next slide, please. So since the start of our engagement, you can really see the drastic increase of social pension budget. So the budget used to only cover 139,000 older persons. So and then increased in 2012 to 186. So it barely increased that time. So and then in 2013, slightly increased. And then this is the start when we started to engage with the budget engagement. So in 2014, it doubled. And then we didn't stop there. In 2015, it also doubled. And in 2015, again, we didn't stop. We again wrote to the senators and tell them that the budget is still not enough to cover what we have promised to 60 years old. So in 2016, it doubled to 1.4 million recipients. And we still didn't stop there. We said that there's still more older persons who do not receive the social pension. So we keep on writing and writing the senators and Congress to provide budget for this. So fortunately in 2017, for this year, it's also doubled. So next slide, please. So for this year, we will have a 2.8 million 2.8 million social pensioners. Imagine, from 138,000 in 2011, this is now the number of pensioners that will benefit from social pension in 2017. So next slide, please. Next slide. Okay. 79 billion from 870 million in 2011. So just to give you a picture, 17.9 billion is 0.13% of our GDP. And then the 870 million is just 0.01% of our GDP. So now it covers 33% of the older persons, older population, from barely 2% in 2011. And then this is also 19 times higher from the original budget. Next slide, please. So, however, even with the expanded social pension, nearly 40% of senior citizens will be uncovered. So we still see that there's still a huge gap on this. So SSS is the Social Security System. This is for the private employees. GSIS is for the government. And the other schemes, AFP is for the military. And then, so you can see 17% is covered during 2016. And now for 2017 is additional 16%. So, but still, you'll see a huge gap there of 38% not have any pension at all. And then, and these 38% are also the ones who mainly came from informal sector or the missing middle, who are not, whose incomes are too meager to contribute to the Social Security, but also they cannot fit in the criteria of social pension because, as I shared to you a while ago, indigent senior citizens is a very strict, very strict criteria. So many older people are also left behind by this. So that's why, next image please, this scenario has brought COSE to push for a universal social pension. So in 2015, we started this campaign for universal social pension. Aside from the coverage gap, we saw a lot of issues in the targeting of older persons, in the prioritizations. So that's why we thought at first that universal social pension should be the best way to address the coverage gap and at the same time to address the targeting issues. And also the financial space for this. Next slide, please. So what we've done so far is that we conducted a feasibility study COSE, together with the support of HealthAge International. One of the authors is Dr. Daniel Horn. And then we have recently completed the feasibility of a universal social pension. So it is a report that we've done for almost 2 years, and then that covers all the rationale why we need to move towards universal. The report also includes how much it would cost, and also the potential impact of the if we give everyone universal social pension. So one of the particular things that we did focus on the report is also the fiscal space. Is that how much money are we talking to, and then where the money should come from. It's always been that question, that where we should get the money. Even we have a strong argument. We have a strong argument that there is enough there's enough reason why we need to move universal. We always trap in the question, where do you get the money? So one of the advices of one of the staff of the senator that we have been in contact with is that we should do a micro and macro simulation as well to our study to show that the money will not put into waste, and it is not a cost but rather an investment to the government. So we did a micro simulation, like how much of the poverty rate will reduce if we give everyone universal, what would happen to our economy and such. So that's one thing that we've done, and we will launch the report this February. And then another thing that we've done is that we met with different government agencies. We did a bilateral meeting. We met a couple of lawmakers as well on what they think about universal. Is it what do they feel about it, and do they think that they will champion it or such. And finally, we also did a networking to a couple of networks on social protection, because we always believe that it is not, universal is no longer a fight among older persons, but it should be every Filipino's fight. So because it's a pension that every Filipino can look forward to in old age. So next slide, please. Okay, so what are the challenges so far that we are experiencing? Of course, the lack of awareness among policymakers. They always think that universal social pension or social pension per se, in the very beginning, would be just a cost to the government. So, but they don't know what are the potentials of this in the economy and also in the welfare of older persons. So it's always been like that, but one of our challenges is that. Another is that the changing government priority. In the previous administration, one of the priorities of the previous administration is on agriculture and an economy. But our new administration now, the priority is on military and also drugs. So it's becoming more of the budget are going through those routes, so that they have this 10-point economic agenda that is mainly about this growth. So among older persons, among the constituency that we work with, of course, we don't believe that even they have low educational level, they can still push or advocate. However, they have physical limitations. When we train an older person today, we will be surprised that the following week or the following years, they will be weak and they can no longer participate on all this advocacy. And then varying views of older persons organizations. Because as I mentioned, there are groups of retirees and there are also groups of informal sectors, which from the retirees' views, they're happy with the discounts that is provided by the government already. They're happy with increased pensions, but only for the contributory pension. They don't care really much about those who do not have purchasing capacity at all, or for the informal sector. So it's always a fight between different classes of older persons in the Philippines. And lastly, is the difference in receptivity of between various ministries. So social welfare might be open for the increase, but budget and management and Department of Finance is totally not open about this one. So between them, even they are in the same cabinets, they are not in good terms, and they are not also having the same view about this program. Next slide, please. I'm just on the last 3 slides. So I'll just wrap this up. Okay. So what are the key lessons learned from all this since we started advocating for social pension? What has been our learning so far? So one of the key learnings we see is that we really need to improve the rights of older persons. We should put them at the center of our advocacy. They should be the one who should be talking to the senators because they know what's really happening. And then one key learning about this is also to spread the capacity building among many older persons, not just one. Because sometimes if it's just one, you need the secondary leaders, also third line leaders up to 4th line leaders, so that the advocacy will continue. Another is evidence-based advocacy. We need to strengthen our evidences, but in such a way that older people can understand. Because if they cannot understand these evidences, it makes no sense. Next is networking. Then strong legal basis. Although we cite ILO recommendations and SDG commitments, to tell you honestly, during budget hearings, they do not care about these international commitments. But more importantly, what we push for is our domestic law. They would cite what domestic law is, rather than what the ILO has been recommending or what the other UN has been recommending. It's been always the domestic law that's prevailed. Last is also stakeholder analysis. What we're doing also in stakeholder analysis is spending more time with those who are with neutral position, because we know if we would waste our time talking to those who oppose it. So we'll just continue working with those in neutral positions so that there's a tendency that their position will be reverted. And lastly, intergenerational support, because we need the support of younger people so that even the older persons are weak, they have the younger ones who will support them. Last slide. I'm done for my last slide. Okay, let me share you this case study. This is a woman, from urban poor. He's 77 years old. It was so stunning about all this work that it's not really, I think for me, it's not really about social pension in the Philippines. That's really the highlight of these campaigns, of these advocacies are. But it's how also a simple older persons can be of who they are today or who they want to be. So we have a lot of older persons who have, like I said, who have very low educational level, who would say they would never thought someone like them would be able to speak to a senator or to congressman. So I think it's one of the highlights of this constituency building, is that it's not only you build support for your advocacy, it's not only about increasing the pensions, making sure that there's a pension for every older person, but it's also what it's happening to the constituency themselves. So in that, I think for us, it's the greatest joy of this advocacy. So I think Dr. Jeremy has covered a lot of the political side. So yes, it is very political as well in the Philippines. So, but I hope you learned something from our experience and from our presentation. I think that's all.
Thank you very much, Aura. That was a great presentation, and I think it shows quite clearly the depth of work that's needed on the ground. One of the things I thought was particularly interesting was bringing together of Jeremy's presentation from a comparative, more macro perspective to what's really working on the ground in your case in terms of getting out those supporters. And I think oftentimes it's difficult to see how those two are working together to get to the same end. We have a few questions from our audience. One is from Vinicius, and excuse me if I'm not saying that correctly, and then Paul, who's based in Switzerland but originally from Cameroon. So I'm going to let Vinicius go on first and let him ask his question. And if you could just limit that to a few minutes, that would be great, just so we can allow some time for other questions to come on. And I will just unmute you now, Vinicius, if you'd like to come on. And I believe these are directed to both Ms. Sevilla and Dr. Seekings. Hello, Paul.
Hello. Hello to all. My question to Mr. Jeremy is how to choose the cost design according to the social characters. If there is some issue, for example, demography of the population, and how to fit the cost design better and generates a greater social impact according to the social characteristics of the population that is being targeted. And my question to Mrs. Aura is if there is some age restriction in order to provide the social protection programs, or if there is a special focus on the type of work, rural workers, urban workers, if there is any difference in order to access the social protection programs for the elderly. Thank you.
Thank you very much, Ms. And Jeremy, if you would like to proceed first, and then Ms. Sevilla, if you would like to go on second. Jeremy, over to you.
Thank you for that question. I'm afraid I only heard part of it, but I think I understood it. Some of the other questions coming in also around how do you tailor the design taking into account local conditions. Let me say two things. I mean, firstly, I think that quite a lot of the program of action, if you like, quite a lot of what you have to do will be true across all contexts. So if we look at the experience of reform in Africa, we can see what's really, really important. The most important thing of all is that you get buy-in from across government. And having buy-in from the one ministry concerned with social welfare is generally not enough. It's very unusual for that to be enough. You have to have buy-in from other more powerful actors in government. So you need to, in general, you need to get that broad political base within government. And some of the things that are very effective are study tours, taking government officials to see countries where programs work, seminars, bringing people from other countries in to talk about how they did it, and so on. These are very effective. But of course, there is variation between local conditions. And there's at least two respects in which local conditions vary very importantly. From the first is, now, what fiscal resources are there? How scarce is money? If money is very scarce, it's much harder. I talked about Botswana. When Botswana introduced pensions, they thought there was lots of money. It was easier for them. And when there's more money, then you don't have to have so much buy-in from government. When there's less money, you really have to have the Department of Finance on your side. And the Department of Finance, if they're not on your side, you've got a problem. So how much money there is going to affect it. The other thing that's really important, I think, are local norms and values. We don't actually pay enough attention to that. We think that if you say this program reduces poverty and we say it's affordable, then governments will go, yes, let's do it. But our research suggests that governments, ministers, senior bureaucrats, senior officials in government departments, they have quite a strong sense of what is right and wrong, and that affects their priorities. It affects what programs they are going to be more sympathetic to or more positive about. Now, there is variation in Africa. In most of the places that we've looked at, which is not West Africa, it's mostly East Africa and Southern Africa, there is generally a skepticism about targeted programs. Across most of Africa, targeted programs, meaning severely means-tested programs, the kinds of programs that the World Bank advocates, are often deeply unpopular amongst national governments and even on the ground. People do not want to have only the very poorest neighbours getting money. That's very unpopular. So highly targeted programs are generally not popular. Universal programs seem to be, generally speaking, more popular. If there is a strong tradition or a strong norm of supporting elderly people, and there's a recognition that families are no longer able to perform that role, then of course that is a very good circumstance. That's a good context for pushing for old age pensions. And this was the situation in Zanzibar, for example, where there was a long tradition of the state doing some things for the elderly, but not very much because family would do it. And then there's a recognition family are able to do less and less, and there was quite strong support for the state expanding its provision for the elderly through old age pensions, and they did so with universal pensions. So it's very important, I think, to look at the norms and to think about how you will get a variety of government officials, a variety of government departments to buy into your program. I actually don't think that the demographics are so politically important.
Thank you, Jeremy. Aura, would you like to come in and comment on the questions from Vinicius?
Yes,
to recap.
So,
okay, go ahead.
I think the question is on the eligibility requirements, right? So one of the, yes, the law says it's 60 years old because that's a legal age of senior citizens in the Philippines. I cannot speak of the broader social protection programs, but I can speak only on social pension. So it's 60 years old and above. But like I mentioned, they have a number of restrictions in terms of presence of illness and with disability, and also sources of support from the family. So if they know, like, you had a family that is supporting you, or you have a children working abroad, or you have a very good house, that might be the reasons why you might be not included in the program, because all of this criteria or that's been set in the law is very subjective. So it depends on the one that is validating. That's one of the gaps of the targeting older persons here. So, but I think in other social protection programs of the government, we have the conditional cash transfer as well. So, which is also a totally different program from social pension. So I think that's all.
Great, thanks for that answer, Aura. I hope that answered Vinicius's question. We have another audience member, Paul, who would like to come in and ask his question. Paul, could you go ahead and ask your questions to Professor Seekings and Ms. Sevilla?
Hello.
Hello.
Yeah, can you get me, please? Hello?
We can hear you good. Thanks.
Oh, thanks very much. Thanks very much for the opportunity. I have two questions for Dr. Jeremy. The first is looking at the affordability gaps, what are some of the strategies or policy options that governments could employ to dilute the need for cash transfers? And the second question is, what is the difference or similarity between the fiscal space and the affordability gap? Thanks very much.
Thank you, Paul. Thank you for that. Jeremy, I believe those two questions are directed to you, if you'd like to take those.
Thank you, Daniel. Thank you, Paul, for those questions. In Africa, as you probably know, I'm not sure where you're from, Paul, but across most of Africa, governments instinctively prefer to invest in developmental programs rather than cash transfer programs, if they see the cash transfer programs as simply temporarily reducing poverty. In other words, they want to expand production, they want to have more food, they want to have more resources in the economy as a whole, and they're more concerned with growth and production than they are with distribution, if you like. So there's obviously many programs which are going to help, and Africa's got a lot of experience in agricultural programs with smallholder farmers and so on. Particularly in southern Africa, programs to try and encourage small farmers to grow more through subsidizing inputs, farm inputs like fertilizers and seed and so on. Okay. These are important programs. But of course, there's two sets of limits to these programs. The first is often they are investments and they help in the future, not in the present, and it doesn't help to reduce poverty amongst the most impoverished sections of the population now. So there's a question of now versus later. And secondly, that those programs don't always reach the people who are most needy. So in many parts of southern and East Africa, the very poor are people who don't actually have productive capacity. In other words, they don't have working age adult members of the household who can go and farm on the land. The poorest households would often comprise the elderly, or the elderly with children, grandchildren, I mean small children, or the only adults might be a mother who is caring for her children and her elderly parents and simply doesn't have the time to be a full-time peasant farmer at the same time. So there are these two limits to agricultural development programs, that we need to reduce poverty now, and we need to reduce poverty amongst households that are not necessarily able to expand production. And this is where cash transfers come in. And I think this is really where cash transfers catch the attention of government officials, when it becomes clear to government officials that what they're doing is helping people for whom there's often no other option, and helping people who we genuinely accept society has some responsibility for example, the elderly. We don't expect that the elderly, when they're in their 70s, are going to have to go out and farm in the fields. We think that their children will look after them maybe, but in a society where the children are no longer able to look after their elderly parents, then there's a strong argument that the state can step in through social pensions. These developmental programs are very important, but they're not a substitute, I think, for social protection cash transfer programs. Your second question was about fiscal space and affordability, or the affordability gap. The point I'm trying to make here, Paul, is that experts can assess that there is fiscal space for more spending, for more government spending. Experts can advise that the government could increase its revenues through extra taxation, for example. And often, I think in Africa, this is absolutely true, that governments are under-taxing their populations, especially the richer members of their populations. That's the one side, the fiscal space side. On the other hand, though, governments are very reluctant to allocate very large sums to social protection programs. If they have extra money, they'll say, maybe we should spend it on infrastructure, maybe we should spend it on agricultural development programs. So I think we must recognize that even if we can see that there is fiscal space in a country, it's another matter to persuade the government that allocating increased spending to social protection programs is their priority. So we really need to identify on which kinds of issues, in which kinds of designs the governments are most likely to be sympathetic to expanding social protection. Thank you.
Great, thanks for that, Jeremy. Some great points about the importance of pensions and the role of building social protection systems. And I think it raises the point of what you might, if I might interject a question here, what you see is the role of pensions in establishing social protection systems, and is that part of the beginnings of a true system from your work, from your research?
So, well, yes, Daniel. Well, historically, I think this is clearly the case that in several parts of Africa, notably South Africa and Mauritius, which were really the pioneer, the pensions, old age pensions.
Jeremy, we seem to have lost you, the audio there. So I'm just going to bring in Barry Herman, who has a question for Aura, I think, or Ms. Sevilla. Barry, if you would like to go ahead and ask that question while we get Jeremy back, that would be great.
Okay, can you hear me? Is this unmuted?
Yes, I can.
Okay. Yeah, so I'm very, this is really a great discussion, very concrete, and thank you for it. I think when, actually it's Africa as well as the Philippines, when advocates go and talk to social ministries or members of parliament and say, yes, you know, we need these social protection programs, and they're told, yes, but there's, okay, wonderful, but there's no money. The answer requires some understanding of taxation and sources of fiscal revenue. And so I'm wondering, you know, do you find allies who are knowledgeable about this? You know, it would seem you have to be a public finance person, you know, to get these things, to answer the critics, however important it is, you know, not infrastructure versus social security, but both somehow appropriately financed, and of course, not taxing the rich, I mean, you know, or at least those who can afford it, taxing the multinational firms that are operating in the country, etc. That's my question. Do you find the allies? Where do you find?
Thanks for that. Barry, that's a very good question. Aura, would you like to address that?
Yes, I think that's something that we're kind of fortunate about. Recently, the government has started the discussion on the comprehensive tax reform, so which covers a lot of tax reforms dealing with decreasing the income tax, but as well increasing the excise taxes. So where did we found a couple of allies who are working with, for an instance, with the reduction of debt, debt servicing, because Philippines is the only country in the world who have this law, which is the automatic appropriations, automatic debt servicing law, which makes debt service as the #1 priority in the government budget. So that's very unique to us. So we found this ally which working on repealing that law, that it should not be the debt service that we need to prioritize, but social services. So that's where we found them. So basically we look for those organizations who share the same vision, who also thinks that social services, social protection should be the first in the budget prioritizations of the government, and then we work with them closely. Like we participate on the annual plannings, we participate on joint rallies, mobilization, even it's not only for social pension, but we join them just to show our support as well to their advocacies, so that they can also support our advocacy. So that's how we increase our allies in terms of advocating for increased money for social pension and social protection also. I hope I answered that question.
Thank you for that, Aura. we're just going to have to sort of wrap up here a little bit, so we only have time for a couple more questions that will be asked by me, simply because to get through some of these. Now, the first question is from Vincent for Aura, and the second will be for Jeremy from Nicolo. Aura, Vincent would like to know if you could describe where the money comes from in terms of financing the universal pension, and also what the approach in providing the pension to the informal sector or the poor who have never acquired any form of income is, that from your opinion. And for Jeremy, there's a question from Nicolo. He would like to know about the old age pension in South Africa being one of the most generous in its kind across emerging economies, and if you could discuss the current challenges, fiscal and otherwise, and the public opinions involved in those, excuse me, and the future of the program. It's quite a big question, and if you could both just maybe consolidate towards 5 minutes each, that would be perfect. And we will, just to let everyone else know, we will address these offline and put them on the website. So Aura, you would like to proceed?
Yes. Okay, thank you, Vincent, for that question. To tell you honestly, social pension, the advocacy for social pension has just started. So the discussion on this universal social pension was just initiated last November, but this has been always been the big question, how to finance it. So we took a lot of time actually looking at how it would be financed. To tell you honestly, the current fiscal space is really huge. The government just allotted a huge sums of money for the pensions of the military, which is enough to fund universal, but would only benefit 3% of senior citizens. But they've done so. So this is what Jeremy is telling. Financing universal pension is really a political question as well. Even technically there is some money. If the political will of the government or the president is not really on it, we would have a very huge problem with that. So to give a story, to give you a short answer, at the current fiscal space of the country, of the Philippines, it can finance universal social pension without doing any tax reforms first. But what we put it in our report, given in the medium term and in the long term, what we are proposing is what we mentioned about repealing the debt services, like somewhat loosening up some of the payments that we give out for debt payment. So that's one. And then another one is the lump sum. Government has many underspendings in the couple of years. They've not spent well the recent budget. So we would like to make this to course this unspent budget towards universal social pension. So that's just two major ones. And then of course also the tax reform on increasing domestic revenues. So on what pension to informal sector, so that's what the social pension is for. That's why we'd like to prioritize first those who do not have pension. So we call this pension tested, to be part of the universal social pension, because those who have contributory pension just had an increase of their pension from the government and from the private sector, but the social pension has not increased since 2010, since it was passed, and it doesn't cover much of the informal sector. So that's why we'd like it to be universal, up to those who that have pension at all, so which are basically coming from the informal sector. So those are just my quick response to Sir Vincent's question.
Thank you, Aura, for that. Sorry, I had a bit of technical difficulties there. Jeremy, I wonder if you could address, are you back with us? Did your audio come back on?
I'm here.
Great, great. So just to remind you, the question from Nicolo was whether or not you could just elaborate on the old age pension in South Africa being so generous, and what you see as the current challenges, fiscal and otherwise, and specifically concerning public opinions and the future of the program.
It's a good question, because the South African social pension, old age pension, is very generous. It pays more than $100 US a month, the equivalent, which is 10 times as much as the pensions in Zanzibar and several times higher than the pensions in Botswana. It's a generous pension. It's not universal, but it goes to almost everybody. The means test just excludes the rich, so it goes to 80 to 90% of the elderly people, and it costs well over 1% of GDP. But it got there for quite a long period of time, and as a series of smaller spending decisions. So it started off as a cheap program, and it slowly expanded, and it slowly became more generous. But of course, the South African case is unusual because it originated in a very unusual context, which was the highly racist context of apartheid. When apartheid states, you remember, wanted to provide generously for white citizens and to exclude the black population, and it became a generous program for everybody when provision for white citizens was extended to black citizens as well. So it's got very accidental origins in a way, very unusual origins, but it is a very generous and a very extensive program. What's interesting about it is that everybody takes it for granted. Nobody questions it. It has total support. You ask politicians or you ask ordinary people, almost everybody says we should be giving pensioners more. Nobody questions it. And there's a very important lesson here, which is that when a program is seen to be fair, even if it's an expensive program, it builds up really very, very strong support base. In South Africa, the elderly people look after often grandchildren, they look after other kin. There's huge support for this program. And I think it's not surprising that in other parts of Africa, old age pensions have also often been the most popular program for similar reasons. That you help the elderly, you're helping people who are seen as deserving, and you're helping other people indirectly because the elderly will typically help their grandchildren and other poorer members of their family. So it is a slightly accidental program. It's a slightly accidental success story, but it's one which does have important lessons. Important lesson, I think, is if you can expand a program slowly and it's seen as being fair, it'll build support for social protection generally and opens up the possibility of all sorts of other programs being introduced. That's the real lesson.
Great. Thanks very much for that, Jeremy. And Aura, thank you very much for your useful comments. Again, I can say this again, that it's very nice to have a very macro comparative experience from Jeremy, and also Aura, your very hands-on experience in dealing with the Philippines social pension. We'd like to wrap up there and just remind our audience, if you could please fill out the survey to help us make this webinar series better. We will be having another webinar series in the future. So if you've enjoyed this, we'll have a much of the same coming up in 2017. And you're welcome to join that. And please stay on socialprotection.org and invite your other colleagues to join us as well. We'd like to promote dialogue and discussion regarding not just providing services and benefits, but also finding the fiscal space and the political space to make that happen. I'd like to say a special thanks again to Jeremy and Aura for joining us today. It's quite late in the Philippines, I know, so Aura's done us the grace of staying on late for us. Thank you very much, Aura and Jeremy.
Daniel.
Thank you too. Yeah, I also learned a lot.
Thank you, and that concludes our webinar.